Good afternoon, everyone, and Happy New Year, Happy 2021. We're already 5 days in, but optimistic about a healthier and a brighter and a better 2021. And today we do have some good news and some significant announcements on our vaccine distribution plan and our vaccine distribution effort. So that is a great way to start our first COVID update of 2021. But first, I'm going to talk about the ongoing situation with COVID in the county. At a high level, what I'd say is we continue to very much be in the midst of the second wave. We're anxiously watching and waiting to see what the impacts of the Christmas and holiday period might be in terms of whether that will add to the ongoing surge in the second wave, or whether we will finally be able to blunt this second wave and start to get on the other downslope of that curve. And that is, of course, what we're all pushing and working towards. By the numbers in terms of where we're at right now, we are at a total cumulative case count in the county of 6,633 since the beginning of the pandemic, about 10 months ago. We have now crossed another threshold on testing and are well over 200,000 tests administered, 201,824 to be exact, and we're pushing every day. I know we still have more work to do to get more testing capacity up, and we are doing everything we can there to increase that. I drove by our Midtown Kingston site with WMC today, with Health Alliance WMC today, and saw that there was a line there. So good news that people are getting tested, but we're doing everything we can to shorten that wait period and the turnaround period on test results. The overwhelmingly positive news is that the vast majority of folks have recovered, 4,242 recovered. The heartbreaking news that I continue to frankly dread every day having to share with you all is that we are still losing people now nearly every day, if not more, one per day or more to COVID. And unfortunately, since our last update on New Year's Eve, we've had 6 additional fatalities of Ulster County residents, bringing us to a total of 144. Just 1 month ago, at the beginning of December, we were at 101. So this has, without a doubt, been the most deadly month period of the pandemic. And my hope is that we can finally slow that rate down. But I do fear, as I said, that we haven't seen yet the impacts in the numbers of the holidays, Christmas, New Year's. So we'll keep you updated on that. In terms of our hospitalizations, this is more cause for concern. We are seeing the hospitalization numbers in the county continue to slowly tick up and increase. You can see the building on the graph. We are currently at 29 hospitalized right now in the, we were at 29. My last update, we are now at 32. I apologize. We're now at 32 hospitalized in the county, with 5 of them in the ICU, and we do continue to see that increase. We anticipate it will continue to increase until we can get this second wave in check. In terms of our active case count in the county, this is one relative bright spot in that our active case count has remained steady for the last week or so, right around 2,100 to 2,300, somewhere in that range, total active cases. Right now, we are at 2,247 to be exact. Again, our hope is that that represents the top of the curve, not just another notch on the way to a growing curve. And we will see here in the next 1 to 3 weeks what those impacts from the holiday period were. Again, we know this from the science, and we know this from the first wave of this. We do still very much control our destiny in terms of keeping the active case count and the total case count in check. We'll talk about more about what we're doing to control that and to blunt that. But we all pretty much know what we need to do. It's a matter of execution and of doing it and reminding each other to do it and holding each other accountable for doing it. In terms of any pockets of like sort of cluster type activity or pockets of concentration of COVID among those 2,247 cases, Nothing too significant because we really are in a community spread situation. We continue to see our senior facilities, our congregate living and group home facilities, including those for folks with developmental disabilities and other congregate settings. That is where we are seeing the clusters because of the fact that once COVID enters those environments, because of the tight quarters and the congregate setting, we often do see it spread. So we've had that continue to be the case now for a month or two, and we are working, as always, our health department works with each of those organizations or entities or facilities or homes to get in there with our rapid response team and make sure that we're diagnosing what's happening and isolating and quarantining as necessary to contain any place that there are clusters in a facility like that. But largely this is community spread driven by social gatherings, as we've talked about before. In terms of the new daily test positivity that we regularly report on, this is very concerning. We are seeing some of the highest rates here of new infection. And again, this is even before we start to factor in we might be beginning to see the Christmas gatherings, and we definitely have not yet seen the New Year's gatherings in these numbers. But in the last 96 hours since our last update, we've tested 4,383, and had 395 new positives over that 4-day period. So for the 4-day average, we're at 9.01% new infection rate over a 4-day average, one of the highest that we've had in the entire pandemic. And in the last 24 hours, even higher at 10.26%. We have to do better than this. We have to do better than this. Particularly knowing that there might be more positive cases coming due to holiday gatherings. Despite our warnings, despite our best efforts, we do anticipate that will happen. And if we're going to have any hope of getting this back in check, and also, by the way, of not incurring significant restrictions, which we'll talk more about in a moment, if we're going to prevent those things, we've got to use the new year as a reason to re-energize and get our vigilance back up, every single one of us, to get this in check. If not, you can see on this graph the cumulative projections. This is for total cumulative cases. In the worst case scenario, approaching 10,000, which would be another 4,000 from where we are now in just the next 2 weeks. Finally, and this is where we'll talk a little bit about potential restrictions. The restrictions now in New York State are tied to our hospital treatment capacity, meaning the governor and the state will impose potential shutdowns or restrictions if we start to get to a point anywhere in the state, including here, where we're at risk of overwhelming our hospital system. Today, for the first time in the second wave, we mark a point of potential concern there that I want to flag. If you look at the graph, we currently have, as I said, 32 hospitalized right now, with ICUs and ventilators at 5. If you look on the far right, though, we, for the first time, are saying that we are at risk, looking out at the current growth rate, we're at risk of getting to a dangerous threshold where we'd have less than 30% capacity. That's the threshold at which we might be eligible for additional restrictions that would impact our economy with potential additional business shutdowns. We know that is not something that we want to do in a broad brush fashion, and so this is another nudge, or let's say a strong nudge to get serious and really change our behavior in terms of our hand washing, our social distancing, our mask wearing, of course, and in particular, thinking about who we're getting together with and who we're gathering with. I've talked about it over and over, but we now know that because, and this is something I probably haven't talked enough about, in the beginning of how is this spreading and why do indoor gatherings matter so much and why are they really driving the spread? In the beginning of COVID, as we were learning about it, we largely thought that droplets of moisture were carrying it, and so we were very focused on cleaning surfaces and so on. But as we've learned more from health experts and scientists, the virus is spread in an aerosolized manner, meaning it is essentially in the air regardless of those moisture drops, meaning it has the potential to travel further, and also meaning if you're indoors with someone for any extended period of time, the risk goes significantly up of transmission. That explains why we are seeing such high transmission rates of gatherings of even 4, 5, 6 people indoors, because if you spend an hour indoors with 4, 5, 6 people, you are breathing the same air as them, and therefore, if anyone is carrying COVID unknowingly, would be very likely to transmit it. So that's the behavior that, although difficult, that we know that if we can change that and affect that, that will have the most impact on blunting the wave. Of course, that's not an excuse to not, when you're out in public, of course, whether you're grocery shopping or doing whatever other essential things you need, to follow all the precautions with masks, distancing, and hand washing. So I know I say it over and over, but clearly it's not getting through to everyone, because if it were, we wouldn't be in the situation that we're in. So please encourage others to heed this advice that we know works, and let's get out of this second wave, and let's focus on the more encouraging side of the update, which I'm about to talk about, which is our vaccine distribution efforts. This is what gives me great optimism and hope for this year of 2021. Of course, in 2020, we were surprised and really on our heels much of the year, doing the best we could to blunt the first wave, to take care of each other, to protect our economy, and to protect those in need across the county. Having a effective vaccine distribution plan really is our first chance to sort of really take the offensive against the virus in a way that will be enduring. And so I'm excited today to announce some major steps and some major components of our Ulster County vaccine distribution plan. At the high level, the goal is very clear and it's simple. There are 3 driving priorities that I've given to our team planning our vaccine distribution efforts. Number 1, it needs to be rapid. As quickly as we possibly can, we need to get this vaccine out to the population as quickly as possible. Second, it needs to be safe, both the operations of how we distribute it, but also we need to ensure that we build trust that the vaccine itself and the health aspects of it are safe. All the science and the FDA approvals and everything to this point leads us to believe that, but we are continue to focus and will continue to focus on safety. The third aspect, which is built into our plan that I'll roll out here in a minute, is equity. We know that so many in our community struggle to get access to our healthcare system writ large. Many don't have doctors or don't have insurance or don't have even the transportation to get to the doctor, or whatever those barriers are. So we are factoring that into our plan. At the end of the day, our plan in Ulster County will meet all of those criteria in terms of speed, in terms of safety, and in terms of equity. And so with that, I'll share some of the high-level details. I'm going to put up a chart that has a bunch of boxes on it. And what I'm going to do here is talk for a minute or two about how this works. And I think, understandably, there are lots of questions because it has been a little bit unclear to this point, particularly from the federal level, but even from the state level, of exactly how this is going to work. So I wanted to, at least here in Ulster County, make very clear how this is going to work. So bear with me on this slide. The top there, and guiding all of our efforts, not just in Ulster County, but in the Mid-Hudson region, is a regional vaccine hub, which is run by Westchester Medical Center that operates in our county and the other counties, and is also working in tandem with the State Department of Health. So at that hub, we have representatives from the State Health Department, from Westchester Medical, from each of the counties, and then we also have representatives from a whole other host of partners who are going to be also instrumental in our vaccination efforts, doctors, hospitals, federally qualified health centers, pharmacies, so on and so forth. I'll talk about that in a minute, but we have all, at the regional level, we have all the players at the table. Here in Ulster County, For the last month plus, we've been in-depth planning, and I'll show you some of those results in a second, our Ulster County vaccine distribution operation. And now coming into the new year, I think we're in a very good place with a plan that has been tested and is in-depth and robust, and that I'm very confident will put us in a good position to meet our goals with vaccine distribution. So what does that look like? That's really the rest of those outer arrows. But if you think about the county vaccine operation there in the middle, that really is the hub of the operations. But there are many spokes that will feed into that hub and make sure that we do this, again, quickly, safely, and equitably. So first off, we as a county will stand up starting next week on January 11th. We will activate our first county-led POD, point of distribution. That's a new acronym that many of us will start to hear more about. POD, point of distribution site. We'll set up our first one in Kingston and our second one later in the week in Ellenville. I'll talk about the details of those in a moment, but those will be county-led with some other partners, vaccine distribution sites that will make up part of the total network of entities that will be getting vaccines out to our 180,000 plus residents. In addition to the county, there will be many other key players making sure that we do this. Those are represented on the left-hand side of this graph, including our pharmacies, both the larger chains and smaller community pharmacies, our hospitals, of course, and their health practices, our federally qualified health centers like the Institute for Family Health, our private doctor and provider networks, and our urgent care clinics, which should be on here but are not on here, so we'll add that for our next update. Those will be the key players, and if you think about the fact that we have almost 200,000 people that we need to vaccinate, each of whom needs 2 doses. We need all hands on deck working together and coordinated to make that happen, and that's what our plan is set up to do. In addition to that, the last aspect that's very important that I want to talk about is our vaccine distribution coalition, which is shown on the right-hand side of this chart here. This is a group that we set up, which is a broad coalition similar to the one we build for our census efforts and other community-led efforts, made up of community leaders and community groups, religious and civic groups, and many others that have trust and influence in the various sub-communities that make up Ulster County. We have been meeting and convening, including our last meeting on New Year's Eve, and this coalition will play a key role in making sure that the community is driving this, that the community has input in both the logistics of how we're doing it and in building trust and confidence in the vaccine. So you see a two-way arrow there on our graph between our vaccine operations and that distribution coalition. And I think that will be critical to making sure that this isn't a top-down thing, but it's really a community-driven effort to get this done the right way. So I know, as I said, that's a lot of moving pieces. I'll talk a little bit more about them in a moment. But what I think is the important takeaway for everyone in the county is to know that we have been working on this plan, and I now feel confident launching that plan, knowing that we can now meet a very high volume of vaccinations. And basically, as soon as we can start getting them, and we do start getting them from the state and federal government, we in Ulster County will be ready to get those out rapidly, safely, and equitably. The 2 point of distribution sites that the county will lead on, as I mentioned, are in Kingston and Ellenville. The first one will be at the Kate Walton Fieldhouse at the Kingston High School campus. That one will be operating starting next week, Monday, January 11th. That will be operating 7 days a week. And the second site will be in partnership, close partnership with the Ellenville Regional Hospital at their site. And I want to thank Steve Kelly and his team for the partnership and the planning and the execution. To start, that site will run Monday through Friday. So these sites will be set up and actually are being set up as we speak to handle a high volume of vaccinations. However, a really important caveat here is that as we start, the limiting factor really is the availability of vaccines from the federal government, number one, and number two, the criteria of who is eligible, which is set by New York State and by the Department of Health. So that's important for people out there to understand that we're doing everything we can here, and we'll be ready to have the sort of distribution, infrastructure, and pieces in place. But until we get those vaccines and until we can open up eligibility to different groups of people, rank ordered by risk and priority, that will really be what limits how quickly we can get this out. And to start, each of these sites, and probably for quite a while, will be by appointment only. And of course, as we get closer to that, we'll be announcing the details of how to get those appointments set up. We don't have that yet, but that will be here in short order. I wanted to share, it'll be small on your screen. Don't focus on trying to read every piece of it, but what I wanted to share is one schematic. This is the schematic that's part of about a nearly 100-page planning document that our incredible team here in Ulster County has put together. This is a schematic of what the Kate Walton Fieldhouse Kingston High School testing site will look like. To give you a sense of this, we'll have 25 vaccination points running at all times through those 7 days a week, and then about 80 sites where folks will sit and wait and be monitored after receiving the vaccine to make sure that they're safe and that there are no side effects, and that we'll have all those health experts on hand to monitor them if needed. Of course, there's all sorts of other pieces that go into this, but what I wanted you to have a sense of and in confidence in is that I was not ready to announce this plan until we really had gone through iteration after iteration of making sure we'd thought through all the details, that we had it right, that we are coordinating with our partners. And as I said, I feel very good about that now. And if you were to go over to the field house today, you would see, and I think the pictures may have already actually been up, these are in progress pictures of the build out happening at the field house. It's still kind of crazy for me to think that this is where I played basketball and went to phys ed, and now we're using it 20 plus years ago, and now we're using it for this. But we improvise, and we are making this happen. And I want to really thank Dr. Padalino and the school board and the school district for their partnership on this, and of course Ellenville Regional and Steve Kelly and his team for their partnership at those sites. What does this all mean? What do these sites mean? What will this result in for the residents of the county? This is really the high-level takeaway. With these two sites alone, these county-led sites, which, again, are part of a broader vaccination network that includes hospitals, pharmacies, providers, urgent care, the county-led sites alone give us significant capacity to distribute the COVID-19 vaccine as we receive it. To give you a sense of our throughput, at those two facilities in Kingston and Ellenville, per month, that will allow us to do up to 50,000, to administer up to 50,000 doses to individual residents of the county in those two county-led facilities. If that's a great starting point for the county, and then if we can add in, again, all those other players and make sure that it's all coordinated, which is what our plan does, that puts us in a very good position to get this done quickly and safely. And so, again, I feel good about that. Important caveat here, again, we will not be doing 50,000 vaccines in the month of January, because the month of January is going to be focused on a very initially focused set of priority health workers and others at high risk, and that is limited not by our distribution capability, but really by the number of vaccines that we've gotten. We, Ulster County, today are just scheduled to receive our first direct shipment of vaccines to the county health department. They've either arrived as we started this briefing, or will later today, as we've been told by the state health department. As those numbers ramp up, as we get more and more vaccines here into the county, that will allow us to add more and more capacity. My hope is that by February, we'll be doing many more and maybe even approaching that 50,000. And by March, where we're at a general availability point, hopefully, that's where we will be able to reach that 50,000 number in our county-led facilities and then add in others. And again, that puts us in a good position to get the 180,000 residents vaccinated. Not all of those 180,000 will probably get it initially because some of them are under 18. But that, again, just some rough math to give you a sense of those numbers. The last point I want to make on the distribution effort is building on what I said before in terms of the sequencing and the prioritization. Here, once again, which I've showed before, is the state framework for the different phases and really the prioritization of who is eligible. We are still in the early part of phase 1 and anticipate being in phase 1 through at least the rest of January, focused on healthcare workers, our senior facilities and long-term care facilities, our group homes, those with developmental disabilities and other group homes. Each week we're adding more and more to this. For example, starting this week, a wider set of doctors and providers are being vaccinated. Our senior facilities are continuing to get vaccinated. Starting this week, Ulster County will be vaccinating 27 different facilities across the county that are those high-risk congregate facilities. So this approach makes a lot of sense to me initially, because if you remember back to what I said about where some of our clusters are, they are in these group and congregate facilities, and that is rightly where we are starting our vaccination efforts, along with, of course, our frontline healthcare workers who are at great risk. Moving in to phase 2, 3, 4, 5, you can see there we broaden out to our other categories of essential workers in phase 2, and you can see phase 3, 4, 5. The key thing here is that in the coming days, we will launch a county page that will have more detail on these phases, and that to know that each week and even each day, we're getting new information from the state about who will be eligible when, and that we will be communicating that through these updates, or through our website and through other means with you all. I know that there's a lot of information here. I know that it's a very anxious time, and that there's a lot of concern and many people who want the vaccine now, and I completely understand that. And we are getting those calls as well. And just know that the same level of energy and attention to detail and effort that kept our entire team here planning this through the holiday period, through New Year's Eve, through all those holidays to get this right, we will continue to bring that same level of effort through every step of this vaccination until every single person that wants it gets it, and we can move into a return to some sense of normalcy in the later part of 2021. The last piece here I want to hit on is I mentioned it before, but the community aspect of how we're doing vaccine distribution. We formed back in November our Vaccine Distribution Coalition and announced some of the initial members. That group continues to grow, and in our last meeting we identified one of our goals is to add more people to that group to really widen in concentric circles the different leaders and trusted voices that will make up that coalition. So we'll continue to build that and update folks there. If you want to get involved, please do reach out on that front. That effort is both to have input on the logistics of how we're distributing the vaccine and our plan, but it's also to make sure that those folks understand the science behind the vaccine, what the benefits are, what the potential risks are, so that can be communicated to every member of our community. So that is the update and the developments on our vaccination plan. As I said, there will be more details to come. We will be constantly looking at, and if needed, adjusting the plan as we go. This is the first time that we've ever done anything like this, at least in the last century. So it will not be without some bumps, But what I can tell you is we'll always communicate through that honestly and transparently, and need your feedback to make sure that we're getting it right. So please keep that coming, and we appreciate it. As we renew our efforts here to battle the virus and to prepare for the vaccine, I want to thank again all of our frontline workers. You will rightly be prioritized in the next phase of the distribution once we get our healthcare workers and our seniors taken care of. And that's just one of the many ways that we're working to thank you and appreciate you for continuing to put yourself at risk for everyone here in the county. I particularly think about those that are public servants that work throughout this holiday period, many without break, to keep us safe and fed, to keep our roads operating, to keep all the things happening that we need to take care of each other through this time. And of course, those working in our hospitals on the front lines of this second wave. Thank you to each of you. And thank you to all of you for tuning in. Our next update will be on Thursday. We did shift the time, as you noticed, back an hour to 3 p.m. So Thursday at 3 p.m. will be our next scheduled update. In the meantime, if you have any questions on COVID, testing, vaccines, and so forth, or any other needs in terms of critical needs to make sure you and your family are taken care of, from food to housing to anything else, please call our Recovery Service Center, 845-443-8888. We are and will continue to be here for you. Radio Kingston has continued to be here for us to bring this to you, so thanks to Radio Kingston. Thank you, Diana Manuel. We're going to keep going with these updates till we get through this thing, and I will see you all on Thursday. Stay safe and healthy, and be resilient, and take care.